Why do ambulances cost so much?
In late March, I had an ambulance called for me.
It was late Saturday night, and for reasons that I cannot infer, I was found throwing up in this toilet.
Because my incident happened on a college campus on a Saturday night with multiple organized parties, EMS was likely already in the area, and between my memory and the case report given to me by my college, I know that the entire response, from the time the ambulance was called to the time that they left, spanned around 18 minutes. The treatment I received consisted of 3 barf bags and an alert oriented assessment, which is just where they ask you if you know your name, where you are, what time it is, and how you got there. And since I was alert and oriented, times four, not to brag, um, I could answer all their questions. I was allowed to sign a waiver refusing transport and further medical assistance, and then I could just be on my way. So after this, I didn't really think much about it because of the fact that, you know, the entire incident took less than 18 minutes and the amount of material I spent was consisted of 3 barf bags. So remember how I said that this happened in March? Well, this October, my family received a bill for over $2,000. Well, 2,230 to be precise. Why did an ambulance ride that I didn't take cost over $2,000? Okay, so maybe that's a little bit of a self centered question. Really, I should be asking, why do all ambulance rides cost so much? Well, not all ambulance rides. That's complicated, and I will be getting into that later. In California, the average cost of an ambulance is, well, it's highly variable. If you look up what the average cost of an ambulance is, you're going to get a lot of very differing results. One result that I found, however, says that it's around $1,854 for basic life support, and for advanced life support, which requires more advanced equipment and more advanced personnel, it's around $2,040. So, either way, and no matter what you look up, it's a lot of money. So, I mean, thank God for insurance, right? Wrong. It's it's time to talk about health insurance. I know, I know. Truly riveting stuff. Honestly, until I did this project, I didn't know a whole lot about how health insurance works. And if you're anything like me, that is, a college student that is going to be mooching off your parents' insurance until you're 25, you might not know a whole lot about health insurance either. So, if you don't want my health insurance crash course, feel free to skip ahead to the segment where I talk about surprise bills. I think that I divided this video. You can see that below. But now, if you are like me and you're clueless, let's go through the basics. To start, there are many different types of health insurance, but for the purposes of this video, I will be focusing on two major categories: commercial health insurance and government funded insurance programs. Commercial health insurance is group health coverage that private employers provide to their employees as part of their benefits package. These plans are purchased by businesses from private health insurance companies. People may also purchase insurance directly from private businesses, but this tends to cost a lot more and is less common than commercial insurance. The second major option is government funded insurance programs like Medicare and Medicaid. People eligible for these programs include people with certain disabilities and elderly adults. Medicare is a federal government insurance program for people over 65 and younger people with certain qualifying disabilities, while Medicaid is run through state agencies and also provides coverage for low income adults. Medicaid varies both in name and in certain policies from state to state, and here in California, where I am, it's called Medi Cal. What type of insurance you have usually dictates which healthcare providers you can go see. When you have commercial insurance and most forms of private insurance, you have what's called a network. A network is a group of healthcare providers that your insurance company has discounted rates with, so you don't have to pay as much. Some insurance plans, HMOs, will not cover any out of network charges. And some plans, like PPOs, will, but they're still going to make you pay a lot more than if you went to a provider in your network. If you get your health insurance through a government-funded program, you typically don't have a specific network, but you are still probably going to have a list of providers who will take your insurance, and you have to avoid the ones who don't. Although your insurance pays for services that they cover in your network most of the time, you are still expected to cover a fraction of the cost yourself. Some services, like vaccines and yearly physicals, you pay a small fixed amount every single time. This is called copay. Other times, you may pay a certain percentage of the cost. This is called coinsurance. If you go to a provider in your network, your co-payments and coinsurance costs will be lower, and your insurance will cover the rest. However, if you go to a provider outside of your network, you might end up with what is called a balance bill or surprise bill. Insurers often have certain allowed amounts that they will pay for a service, and once the bill goes over that amount, well, the rest is on you. This doesn't really matter for in-network prices since negotiated rates are lower than the allowed amount. But for out-of-network, the gap between the allowed amount and the price of the service can sometimes be thousands of dollars. So that's scary because there's a lot of situations where you just can't choose what provider you're going to get healthcare from. For example, when you have an ambulance called for you. Thankfully, there are some federal protections against balance billing. If you have Medicare or Medicaid, great news, there are policies put in place to protect you from any balance billing. The provider has to accept whatever amount that Medicare pays for your care and cannot come knocking at your door asking for the rest. So that's good, but what about commercial insurance? So if you have commercial insurance, the Federal No Surprises Act protects you from most surprise billing in situations where you might have not had much control over whether you got treated by a provider in your network, such as trips to the emergency room and non-emergency services from out-of-network providers in network healthcare facilities, which sounds a little bit complicated, but apparently there's just like out-of-network anesthesiologists just knocking people out left and right. Like you're at a hospital that's in your network getting surgery from a surgeon that's in your network, but the anesthesiologist is not in your network and you have no idea because they just knocked you out flat. I had no idea that was an issue, but it's really good that the Federal No Surprises Act protects you from this. So you would think that the Federal No Surprises Act would also cover surprise bills from ambulances, but it turns out that while air ambulance transports are protected under this act, ground ambulance fees aren't. So if you can't choose what ambulance gets called, who does? When you dial 911, the ambulance service that responds is determined by what zone you're in. For example, LA County has 9 zones, and since I was in zone 3 at the time of the incident, the ambulance service that was called was Care Ambulance Service, which, by the way, if you look up, the first result is not actually the correct service, and if you scroll down a little bit, you find that since 2010, it's actually been a subsidiary of Falck USA, which is a subsidiary of Falck, which is a healthcare company based in Denmark. So a lot going on there. Also, this is irrelevant, but one of the investment groups that also owns a significant share of Falck is owned by the same folks who invented Legos. So, that's pretty neat. But getting back on track, the reason that the ambulance company that responds matters is that some of them might be in your network and some might not. Which, again, considering that you have no choice over which one responds because they just respond based on what zone you're in, doesn't really make much sense that they would be in and out of network, but they are. Welcome to America. So, as it turns out, Care Ambulance Service, or Falck USA, or Falck, or whatever you want to call it, it's not in my network. So, that means I don't get a discounted rate, and in addition to the $460 we paid for the deductible and coinsurance, they're also balance billing me $0. I love California. I used to think that the thing I loved the most about it was the Northern California coastline, but now I know that it's actually Assembly Bill number 716 on emergency ground ambulance transport. Passed in 2023, Bill 716 targets the practice of surprise ambulance billing. Under this new law, people with state regulated commercial insurance are now prohibited from receiving surprise bills from out of network ambulance services. Instead, your insurance cannot stop paying at their allowed amount and must cover the entire cost, regardless of if the ambulance service is in network or out of network. Even better, under this new law, you only pay the co-insurance that an in-network ambulance would cost. But why is this a big deal? I mean, how often do people get charged out-of-network charges? Well, it turns out most of the time. In a KFF analysis of IBM MarketScan data conducted in 2018, they found that 73% of ground ambulance rides among people with commercial insurance resulted in out-of-network bills. California had some of the highest out-of-network expenses, but people in other states get charged out-of-network as well. The same study found that across the United States, 51% of all ambulance rides had out-of-network bills. As of December 2025, only 20 states have legislation protecting people from surprise ground ambulance bills. What's more is that the legislation greatly varies from state to state. For example, the legislation in Colorado only applies to private ambulance services, and in Florida, it only applies to HMO plans. Unfortunately, I don't have the time to unpack the no surprise legislation from every state, but I have included some resources in the description of this video, including linked data from the Commonwealth Fund that summarizes the protections that every state has, along with a document of all the sources that I've used and cited in researching this video. So if you're curious about any of this, I highly encourage that you look it up. So, we've established why it is that ambulance rides often result in high out-of-pocket expenses for patients, with little being covered by insurance. But the question remains, why are those ambulance bills so high in the first place? Well, right off the bat, I can tell you that the ambulance bill and the service provided are not always proportionate to one another. This is obvious when you see cases of disproportionately high bills, over $2,000 for no transport. But less obvious are the times when ambulance services actually get paid less than their reported costs per response. So, what do I mean by that? Earlier I mentioned that people with Medicare and Medicaid are protected from balanced billing. This is because ambulance services are required to accept the amount that Medicare pays for their services. The base rates for these services are determined by the ambulance fee schedule, or as you'll commonly hear me call it, AFS, and this is put together and updated every year by the Centers for Medicare and Medicaid Services. Factors taken into account on the AFS include RVU and locality. RVU refers to relative value units and is a measure RVU refers to relative value units and is a measure of the level and urgency of care provided, with higher RVUs having higher corresponding base rates due to the presumably higher cost of delivering those services. Locality refers to different geographic price cost indices, or more simply, the cost of operating in an area. Whether prices are actually adjusted appropriately to meet these factors is technically up for debate, but there's a lot of indications that they aren't. In 2024, the Medicare Ground Ambulance Data Collection System, GADCS, reported that higher traditional Medicare ground ambulance transport volume is associated with lower revenue per response, with services in areas with high transport volumes people and Medicare earning an average of $299 less per response than those with high transport volumes Medicare patients. So, in essence, the larger percent of the population that's on Medicare in an area, the less ambulance companies responding to those patients make. At first, this was confusing, since GADCS also reported that Medicare made up the highest percentage of the revenue for ambulance services, about 33%, while commercial made up about 30%. Furthermore, according to the US Census, only around 19% of the population is on Medicare. So why does 19% of the population account for 33% of the revenue for ambulance services? And also, how on earth does that match up to ambulance services losing money on Medicare patients? So, I forgot about senior citizens. I forgot about senior citizens and the fact that people 65 and above are eligible for Medicare. In fact, according to the US Census, around 94% of US citizens above 65 are on Medicare. It's a known fact that as you age, your risk for health-related emergencies tends to increase. This explains why, while the percent of the population in the US over 65 in 2024 is only 16.4, according to NEMSIS, the National Emergency Medical Service Information System, 49.8% of the ambulance responses were for patients over the age of 61. So now the pieces are starting to fit together. Medicare recipients make up a large portion of transports and a disproportionately small percentage of the revenue for ambulance services, which begs the question, how much is Medicare paying for ambulance services? This is the equation that Medicare uses to determine the base payment, without mileage, for any ground ambulance service. I'm going to use it to calculate the theoretical base rate that Medicare would have paid for my ambulance. If you go to cms.gov and look under the Medicare fee schedule, you will find the AFS public use files. For the purposes of this video, I looked at the AFS for 2024, since the majority of my other data was also from 2024. The download consists of two documents, one with zip codes and their corresponding locality number, and the other with the actual fee schedule. Using the first document, I found the locality corresponding to the zip code of my ambulance incident. Then, looking on the ambulance fee schedule, I found the geographic practice cost indices, right here, of corresponding to my locality. And it was 0.0, it was 1.003. Okay? And that's what adjusts for basically the location where the ambulance incident happens. So my incident was a BLS emergency response and would have had an RVU of 1.6. This value right here, CF, refers to conversion factor, which gets a little bit confusing because on the public use files, they refer to it as the base rate, but this isn't true. It's actually the conversion factor. The conversion factor updates every year based on inflation, but there's no variation for locality or level of service. For 2024, the CF was 278.98. So $278.98. Sorry for my handwriting. And let's see, 278.98. So, having plugged all that in, Medicare would have paid Falck around $447. And feel free to calculate this yourself. If you can read my handwriting, it's not the greatest. Except they wouldn't have, because while everything I plugged in is correct, what I didn't mention is that Medicare does not pay for ambulance responses that do not result in patient transport. So Falck actually wouldn't have gotten a single penny. So then, what are Falck's usual rates? Well, the answer to that is both a lot more simple and a lot more complicated. If you go on Falck's website and try to look up the rates, you will eventually just be hit with this really vague response. It wasn't until I looked at the LA County ordinance that I got my answer. As it turns out, ambulance costs are usually capped by either the state or the county that the response takes place in. The maximum rates in LA County are updated July 1st every year. In March of 2025, when I had an ambulance call, the maximum allowed rate for a response to an emergency call with the BLS level equipment and medical personnel was $2,230. You might recall, Falck billed my insurance for exactly $2,230. Crazy coincidence? No. Ambulance companies will just generally bill the maximum allowed amount. To put it plainly, part of the reason that ambulance bills are so high is because of cost shifting. The revenue that they got from my response makes up for some of the money that they lost responding to people covered by Medicare. But how much should Medicare be paying per ambulance ride? The truth is, I don't know. And it seems like no one in the Department of Health and Human Services does either. If trying to understand the response revenue of ambulance services feels like opening up a can of worms, trying to understand the actual cost breakdown per response feels like jumping into a barrel of maggots. Across the board, it seems like the majority of operational costs are from labor, but at the same time, EMTs and paramedics are horrifically underpaid for their literally life-saving work. The sheer variety of types of ambulance services is headache-inducing. There's private and public, private for profit and private nonprofit, ambulance services associated with hospitals, ambulance services operated by private hospitals, and ambulance services contracted by hospitals. There's public ambulances run by fire departments, and public ambulances run by government agencies, specifically geared towards medical emergency response. In California alone, there are 715 public and private ambulance service providers. That's insane, especially considering that there are only 337 zones statewide. And this sheer quantity and variety of ambulance services makes it hard to understand what their actual cost of operation is. Figuring out the cost of fire department run ambulance services is difficult because of their dual purpose. While across the board it seems that the majority of operational costs are from labor, government employed EMS personnel tend to make more than those who work at private ambulance companies, since many of the government employed first responders are also firefighters. Not only is the cost of labor higher for fire department run services, but they also have to split their time and resources between responding to fires and to ambulance calls. The specialization of private ambulance companies means that they can more efficiently operate ambulance services. But for-profit private ambulance companies also come with some downsides. Private ambulance companies tend to spend more on equipment and vehicles because they don't have the same buying privileges as government services. And since they aren't supported by taxes, they tend to rely a little bit more heavily on per-use service payments. And then you have to take into account the fact that while government-run ambulance services are not allowed to make a profit, for-profit ambulance companies definitely are. Seeing as services are contracted to an area and consumers have no choice over which company responds to their 911 call, there's a real risk of them price gouging. In many of the articles I've read, I've heard the American ambulance system referred to as a Franken system, and that's not so far off. The truth is that the American ambulance system is still relatively new when compared to a lot of other parts of our healthcare system. The American ambulance system is such a mess and so complex is because it wasn't one developed with a lot of planning, more so was one developed with just a lot of necessity. And so a lot of different people came up with a lot of different solutions, and now we have a Franken system. This is a relatively long video, but if I were to walk you through all the different steps of research that I've done for it, it would be about 10 times longer, because when I tell you that so much of this information is just so buried and difficult to find, I mean it. Let's say you'd never watched this video before, and you got billed for an ambulance ride that you took, right? Your first inclination might be to go and look at the website of the provider who picked you up and look there and, just try to figure out your rates. But that's not going to tell you anything because they never list the prices on their website because they're always determined by region. And most of the time, nobody just tells you that. Luckily for me, I was able to find the base rates in the LA County Ordinance, but it's not like that everywhere. In a lot of places, the base rates are actually buried in transcripts for town hall meetings. And for a lot of places, they're actually not determined by the county, they're determined by statewide limits. Part of the reason why the Federal No Surprises Act doesn't include ground ambulance services is because the federal government just doesn't know how much ambulances cost in different regions. And I mean, to some extent, I can't blame them. Because all this information is so hidden and so hard to access half the time, it's really difficult to get a good sense of how much an ambulance should cost and therefore what the cap limit should be, and just how are you supposed to make legislation around controlling the cost of ambulances and how much people are getting billed when you just don't know how much people are getting billed. At the moment, there's a federal committee working on trying to add ground ambulance services to the Federal No Surprises Act, right? But the thing is, they're struggling because of the fact that there's just no database with all of the ambulance rates across the country. And it's just very difficult to figure out how much ambulances should cost. And in the meantime, people are continuing to get insane out-of-pocket surprise bills because, again, only 20 out of 50 states have any type of balanced billing protections. And they're not even always just fully extensive. So what can you do? Well, to start, knowing how much an ambulance would cost you is pretty important, and as I said earlier, I have included some information on state legislation banning balance billing for ground ambulance services, but I encourage you to dig a little bit deeper as well. Know what your insurance covers and know its co-insurance policies. If you're in a state without ground ambulance balance billing protections, look up what zone you're in and check to see if the ambulance service that is the primary responder is covered by your insurance. You can do this by looking up your county or city and ambulance zones. Look for the max ambulance rates in your city, county, or state. I found the ones for LA County in the business license section of the county ordinance. And if you're in a state that doesn't have ground ambulance billing protections, keep an eye out for local and state proposed legislature on the topic. One last thing I want to say is that while ambulance prices can be terrifying, it's important to remember just how necessary these services are. So, if you're ever in a situation where you're considering calling an ambulance but you're scared of the bill, please just call. Yeah, I know, surprise ambulance bills suck, and I just spent an entire video talking about them, but you can always try and dispute the claims later. You might not succeed, but what you can't do is you can't bring someone back to life. And whatever regret you have for calling that ambulance will be infinitesimally smaller than whatever you regret you might potentially have for not calling that ambulance. And I want you to remember that. But on a lighter note, if you made it this far, thank you for watching. And also, you might have too much free time.